Hi, today I'm going to do a platelet-rich stroma treatment to the right knee of my patient. The patient is a 66-year-old female. She has been suffering from osteoarthritis of both knees. The right knee was more painful and she has decided to undergo a platelet-rich stroma treatment to the right knee. Platelet-rich stroma treatment is a new and revolutionary treatment to alleviate and even rectify the pain and the condition of osteoarthritis. It is a cellular therapy procedure where one injects cells along with the blood products into the knee joint. The procedure is done as a daycare procedure. The patient walks into the operating theatre. The procedure is done under local anesthesia. There is no keyhole surgery involved. There is no arthroscopic surgery involved. Again, listen. There is no keyhole surgery involved. Hence, there is no anesthesia involved. Keyhole surgery, and therefore anesthesia to do the keyhole surgery are totally irrelevant to this procedure. The delivery is done precisely under ultrasound guidance, which is a separate procedure. At the end of it, there is no need to put an arthroscope into the knee, look into the knee, trim the menisci or make holes in the bone. Nothing is required. The tissues are prepared from the patient's own body. It's all done under local anesthesia. The patient experiences very little pain. And now I'm going to show you the MRI scans of the patient. This is the MRI scan of the patient. These are MRI scans with cardiogram. They show joint space narrowing and loss of joint space cartilage in the weight bearing part of the right knee joint, and there is also cartilage loss under the patella. There are white areas of chondromalacia in the patella, and I will be injecting both the knee and the bone with the relevant substances, that is platelet-rich stroma and platelet-rich plasma. So let's see the procedure. Now the patient is the operating theatre. Let's go into the OR. We have already prepared the PRS, and the PRS is going to be injected under ultrasound guidance. So this is the ultrasound machine, and we will be scanning the leg with this probe. This is a linear probe, 12 megahertz frequency. The gain has been set to the correct degree, and the focal points have been set to 1. You can see that yellow one there. I will be scanning the knee with this ultrasound probe, removing the effusion into the knee joint. There is an effusion in the knee joint, and we will be removing that effusion. I will be showing you the effusion. I will be removing the effusion by inserting a needle under ultrasound guidance, and then inject the platelet-rich stroma into the knee through the same needle. So now I'm going to take some gel over the probe. This is sterile gel. So the whole procedure is done under aseptic precautions. So this is the side of the probe, which is to the outside, and I am now bending the knee and placing the probe. So you see that black area? That is the area of the effusion. And the needle will come from here, from outside, and will go into the area of the effusion. So I'm injecting local anesthesia into the outside of the leg. Madam, any pain here?
No.
Look at it. Look at it. Fluid over the cut. Fluid has been drained out. You can see the needle there. All the fluid has been aspirated. The needle is now confoundedly inside the knee joint. I am removing the ultrasound probe. So this is the fluid which has been drained out. This is the PRS solution. I am going to inject it now. The needle is already inside. Done. Procedure over. Doctor.